Hi, I'm Dr Srinivas. I'm a diabetes care specialist. Today, we are going to discuss what is diabetes. Why is it so important to know about diabetes? Why is it so important that we should control our diabetes or reverse our diabetes? Diabetes is a chronic disorder where the body is not able to use the glucose we eat in the food for its daily functions. It is so important to control this blood glucose in our body to prevent complications of diabetes. There are two types of diabetes, mainly two types of diabetes. One is type 1, other is a type 2. And there are other types like gestational diabetes, maturity onset diabetes of the young and young. But for all practical reasons, we will discuss about only type 2 diabetes. Why? Because this is one of the most common forms of diabetes, and this is a chronic disorder and it leads to a lot of complications. What are the complications of diabetes? It affects your eyesight, it affects your nerves, it affects your kidneys, it affects your heart. And that is the reason it becomes so important to know about diabetes and control diabetes. Diabetes is, especially the type 2 diabetes, is a disorder seen in people who are about the age of 35 or more, and people who are obese, people who are in sedentary lifestyle, who don't take care of their health, who don't have a workout regime, who don't have a proper eating habit. And if you have a family history of diabetes and you are above 45, and if your waist size is more than 40 in men, if it is more than 35 in women, and you don't work out and you are eating too many refined sugars like the junk foods, and you have been avoiding going for workouts and you have not been walking properly, you are at risk of diabetes. How do we know if we have been or are at the risk of becoming a diabetic? You have to look for the symptoms, that is excessive thirst, excessive urination, excess hunger, blurring of vision, and excessive sweating, and recurrent urinary tract infections are also one of the most common presentations in diabetes. How do we diagnose diabetes? It's a very simple thing. You have to take a reading of your blood sugar, which can be done with any handheld glucometer, which can give you results within 5 seconds. If it is high, please go back to your doctor. Ask him that I might be at the risk of diabetes. I want to rule out if I'm a diabetic or not. Then they will do some tests, which is one most common test used to do. We do to diagnose diabetes is a HbA1c test. If your HbA1c is more than 6.5, you are a diabetic. If it is less than 5.7, you are not a diabetic. Between 5.7 to 6.5, you are a pre-diabetic. Why this becomes very important is diabetes is a disease which can be diagnosed 10 to 12 years before its onset. It is here we can advise you on your nutrition and we can give you advice so that we can prevent diabetes. How do we prevent diabetes? Stop eating refined sugars, start a workout, seek your advice with the doctor. He will help you, or you can call us, you can talk to us, we'll help you, giving you diet counseling, and we will follow it up with you over a period of time and see to it that your HbA1c never goes beyond 6.5. For anything else, our numbers are here, please call me. Please wait for our next videos where we'll talk in depth about preventing diabetes and most importantly, reversing diabetes. Keep watching, eat healthy, stay healthy.